Moda Health. Great. Thanks a lot. So the future is already here. It's just not very evenly distributed. These were words spoken by William Gibson back in the mid '90s on an episode of Fresh Air with Terry Gross. He was talking about the internet. Remember, we had the internet in the '90s, but it wasn't as ubiquitous as it is today. Well, I think this applies to how we pay for healthcare as well. Currently, we have value-based care in this country where we pay for quality and outcomes. But by and large, most healthcare is paid for under a volume-based methodology or a fee-for-service system. So as a physician, it's my job to work with my patients to try to understand what's ailing them, to try to come up with a diagnosis and treatment. Typically, this starts with listening to their chief complaints. As a healthcare insurance executive, I listen to the chief complaints of our purchasers and our members. Unfortunately, there's a lot of them. Some of these chief complaints include high healthcare costs. As we've heard, we rank very high in the world in terms of what we spend on healthcare, over $10,000 per person per year, but we fall way short in terms of outcomes. We rank about number 30 in the world in terms of healthcare outcomes. Most healthcare we deliver in this country is reactive. We're very good at delivering sick care, at diagnosing and treating disease, but we fall short in providing preventative services and managing chronic conditions. Additionally, most care is volume driven. And by that, I mean we try to deliver more and more care, not better and better care. This is for several reasons. You talk to hospital CEOs, they talk about the importance of heads and beds. You talk about primary care physicians, it's the 10-minute, 15-minute office visit, the treadmill of seeing more and more patients. As a radiologist, I'm paid for every exam I dictate. I'm not paid whether or not I make the correct diagnosis, if I follow evidence-based care guidelines, or if I try to coordinate the findings that I make on an exam with the patient or the referring provider. This, of course, all results in a frustrating member or patient experience. We're paying a lot for healthcare, but what is the value that we're getting from this? It's hard to quantify, kind of as we already heard from some other speakers. But what's the diagnosis? Well, I think there's many factors contributing to these complaints, but one of them is basically how we pay for healthcare, and that's with our fee-for-service system. So this gets all to the ICD-10 and the CPT code system we've had in place for over 30 years. But beyond that, I think we need to think about other causes that or other ways that we can fix this. I feel value-based care is one way we can address this volume-based conundrum that we're in. Value-based care, it's kind of a nice sounding phrase, but what does it really mean? Well, at Moda, we characterize value-based care as paying for quality and outcomes. In the U.S. now, we have a pretty robust model that characterizes all the different value-based care payment systems out there. It's called the LAN model. I won't get into the details of that model, but for this group, I'd like to share some of the key elements that I think are important for understanding what makes value-based care successful. For one, it's having shared financial risk arrangements in place with providers. In other words, we develop shared global budgets between providers and payers. We figure out what the annual healthcare costs for a population should be, and then we ask providers and payers to work together to try to manage healthcare costs under that arrangement. If there's savings, or so-called upside risk, then those savings are shared back with the providers and the payers. If there's a deficit, then we ask both the providers and the payers to try to make up that deficit jointly. But beyond shared financial risk, we need to employ more what are called alternative payments in paying for healthcare. For too long, healthcare has been very transactional in nature, but really healthcare is this kind of intimate service delivery between one individual and another. So we have to acknowledge that somehow and come up with other ways to pay for that. Some of the ways at Moda in which we're using alternative payment models include things such as care management fees, where we're paying providers a per member per month amount to manage certain populations. This can be used for supporting things such as team-based care or supporting care that might not be characterized with the CPT code. We're also paying providers for meeting certain performance metrics. So we'll look at a payer's patient panel and see if they've done colorectal cancer screening or diabetic screening on a certain percentage of that population and pay them for that. Additionally, we're also rewarding providers if they're able to help maintain costs within a fixed trend rate. So healthcare costs are predictable from year to year. We're also using capitation to some extent. A lot of value-based care hinges on the success of primary care. We're working very hard to encourage our members to see what are called recognized medical homes. I like to call these primary care clinics on steroids. They often offer more continuous coordinated care than a typical physician's office would. They offer additional services such as integrated behavioral health or patient portals, which allow patients to access their care outside of normal hours. But really, for all this value-based care work to be successful, and we've heard it a little bit before, we need to be better in terms of data exchange. So we have a lot of data on the provider side, a lot of payer side, but it doesn't really aggregate very well, and we're not very good at making it actionable for the frontline payers or providers. So this comes in three flavors, essentially: clinical data, financial data, and care management data. I think we're seeing some platforms such as Healthy Planet through the Epic system that are making this aggregation of data more actionable, but we have a long way to go. So I think the future is bright. It's not quite here yet, but we will eventually move more and more toward value-based care. Moda sees itself as a leader in this realm, and it's a big part of my life. So anyone would like to talk more about value-based care afterwards, I'd be happy to do so. Thank you.